Oh, so this is chapter 17, chemicals and the neonate, the potential consequences of drug use during pregnancy. Scope of the problem. Nicotine and alcohol are the two most frequently used substances during pregnancy. About 16.3% of pregnant women smoke, and 10.8% consume alcohol, while only 4.4% abuse illicit drugs. An estimated 10% of women of the childbearing age meet the criteria for admission of a substance use treatment facility, but 85% neither perceived a need nor were referred for treatment. About 32% of umbilical cord samples tested positive for various compounds. A period of special vulnerability. Teratogens are compounds that have a negative influence on neonatal growth and development. The effects of drug use depend on the following: when the compound was used, frequency, duration, and intensity of the substance use. Those who misuse alcohol or illicit drugs during pregnancy should be categorized as high-risk pregnancy. A first trimester is a period of rapid development during which organ differentiation takes place. About 60% of the blood that the fetus receives from the umbilical cord is processed by the immature fetal liver. Blood-brain barrier of the fetus is still immature, so many compounds can enter the nervous system. Fetal circulatory system has lower blood protein levels than an adult. A period of special vulnerability. These factors can magnify the effects of a toxin on the body of the fetus, with lifelong consequences. Mothers who used substances during pregnancy and who developed postpartum depression were far more likely to attempt suicide in the first year after the child's birth. Alcohol, 1 of 4. About 10 to 19% of pregnant women use alcohol at some point during pregnancy. Alcohol easily passes the placenta, and fetal blood alcohol levels rise quickly. Alcohol is a teratogen as its main metabolite. Infant faces withdrawal symptoms 3 to 12 hours after delivery. Fetal alcohol syndrome, fetal alcohol effects, and fetal alcohol spectrum disorder. The third most common cause of birth defects, and the most preventable, is not a recognized medical diagnosis, but a theoretical construct. There is no safe level of alcohol exposure during pregnancy. Just 4 to 6 drinks per day will result in 2/3 of children developing FASD. Maternal alcohol use inhibits chemical known as gangliosides that play a role in brain development. Most active during first trimester. More likely that the child will go on to develop an alcohol use disorder. Characteristics of FASD are as follows: lower birth weight, characteristics, facial abnormalities, smaller brain size at birth, abnormal brain areas. FASD, later in life. These children often demonstrate behavioral problems such as hyperactivity, short attention span, impulsiveness, poor conditions, poor coordination, and numerous other developmental delays. Alcohol use history can impact the effectiveness of breastfeeding, and alcohol can pass into the breast milk. Use of acetaminophen and Amphetamine-Like compounds during pregnancy. There's very little research into the specific effects of maternal amphetamine use on fetal growth and development, but babies do not seem to be born addicted. Women who abuse methamphetamine during pregnancy are more likely to be younger, live alone, and have a lower income educational level and receive less prenatal care. Infants exposed to amphetamine in utero are more likely to experience premature birth, and those exposed to methamphetamine are 3.5 times as likely to be small for gestational age, more likely to display higher levels of emotional reactivity at ages 3 to 5, and higher levels of anxiety and depression. Benzodiazepine use during pregnancy. Small amounts of benzodiazepines can cross the placenta and enter the fetal circulatory system. Fetal blood concentrations differ from one substance to another. Maternal benzodiazepine use during pregnancy will result in the child experiencing potential life-threatening withdrawal symptoms. Cigarette smoking during pregnancy. Between 16.3 and 28.6 of pregnant women smoked during their pregnancy, which is associated with obesity during adolescence. Exposure of infants to secondhand smoke increased the odds of respiratory tract ear infections and asthma in later life, and mothers are at risk for vaginal bleeding. It is recommended that mothers abstain from cigarette smoking if she plans to breastfeed her infant. Nicotine replacement therapy is preferable over continuing to smoke while pregnant. Cocaine use during pregnancy. Research has provided inconclusive results. Estimated that 100,000 infants exposed to cocaine in utero. Negative impact on brain development may be related to lower fetal growth and premature placenta separation. Laws were enacted in the 1980s in many states mandating prison for pregnant women who use cocaine, but there were unintended consequences. Hallucinogen use during pregnancy. Research limited partly due to the broad spectrum of such drugs. MDMA, impact on motor skills and coordination at 4 to 12 months, and coordination skills at 12 months. Cognitive skills at 12 months. PCP. Exposure in utero increases risk for hydrocephalus, respiratory problems, abnormal organ development, may be related to attention, consciousness problems immediately after birth. Substance use during pregnancy. Inhalant. Evidence suggests cause for growth retardation in utero, developmental abnormalities, fetal death, and SIDS, among others. Marijuana, limited research, and difficult to separate effects of marijuana from other drugs like tobacco, potency of marijuana, frequency of material use, and how deeply she inhaled. Other compounds being ingested as well. So over-the-counter analgesic use. Aspirin crosses the placenta. Evidence that aspirin use during pregnancy might be a cause of stillbirth and perinatal mortality. Acetaminophen, often recommended as an alternative to aspirin during pregnancy. However, evidence that exposure to acetaminophen in utero might increase the infant's risk of developing asthma in childhood. So that's it for this video. Thank you for listening.